This is the Chapter 9 lecture, The Health Workforce. Of course, the workforce is essential to the delivery of healthcare, and it includes a variety of professionals. A fact that I thought was very interesting is that the compensation or salaries for those jobs accounts for half of healthcare spending. So it plays a very important role in economic development and income distribution. The health workforce describes all professionals and workers who contribute to the delivery of healthcare. So it might be those that you think of, such as physicians and technicians and dental assistants and nurses, but it also includes home care aides, personal assistants, school nurses. If you look on page 233 of your textbook, you'll see healthcare occupations in the United States by the number of workers. Perhaps no surprise, the largest occupation is the registered nurse. But next on the list, you'll see are personal care aides and unlicensed nursing assistants. And this is really important to think about. We have a large number of individuals doing very important work in delivering health care who are earning low wages and perhaps in some cases also have limited training. And I am not reflecting on the quality of the work or the importance of the work, but the low salaries and low training could be a concern. Anyone who works in healthcare or a healthcare industry is part of the health workforce, so that includes public health departments, researchers, advocates, innovators, etc. Your textbook covers health workforce planning. We have much less of this than other comparable countries. So there's no centralized healthcare system and little national health workforce planning. We operate on a supply and demand system, which may not work correctly in the field of healthcare. Education is another aspect of the health workforce, and the requirements, as I've mentioned already, vary significantly from some individuals doing very important work who don't have formal training, more on the job training, and others being required to earn not only a college degree but beyond to a postgraduate degree. When we look at the institutions who provide this education, again, we see a great variety in terms of type of schools. There are the for-profit schools, there are public schools, community colleges, public and private colleges and universities. And as many of you have realized by looking at perhaps the next step of your own academic path, private institutions are much more expensive than public institutions. So when you compare something like Jefferson or Drexel to a public institution, you see a much higher cost to this education. The reason for the expense of these healthcare education programs are many. Okay, they need facilities, so these programs all have some type of laboratories. In Community College of Philadelphia, each of our select programs has a lab. It is a different type of lab with different equipment, but they all have a lab. They require closely supervised clinical training. You just can't allow students to perform as nurses or dental hygienists or radiographers without close supervision. There's less incentive to expand healthcare programs, and faculty demand higher pay. And this is because working as a professional often earns a higher salary than taking on a teaching job. Projected earnings may also affect the career path. There's another type of of education in the health workforce that is coming into play, and it is called interprofessional. So be sure to read about that. Traditional programs are siloed. So we have a nursing program. We have a respiratory therapy program, and there are schools and programs for each of these professions, but very little interaction between the different professions. Interprofessional education programs are designed to encourage the coordination and cooperation between these different professionals. And the belief is that this will not only make education richer, but may improve quality of care and patient-centeredness. So, what are some innovative models for health workforce education? Traditionally, we have the lecture or didactic classroom and the clinical, okay, and that is typically what you see in health programs. But simulation has improved dramatically because of the advances in technology. So simulation is state-of-the-art simulation is now being used, so this will lower the risk to patients and lower the need to find more clinical settings as well. Technology has also advanced, so we have greater capability to have online web-based video conferencing, thank goodness, during the pandemic period. And the other model that is gaining some traction is to have shorter training programs or accelerated programs. So we'll see that in some medical schools. Now, some professions are pushing for higher educational standards. We see that with RNs, which are typically being required to hold a BSN or higher by 2020, which we are now in. We see this with physical therapists, we see this with pharmacists, we see this with a number of different therapists, we see this with nurse practitioners as well. So we're pushing more and more education, with the focus being on greater skills, of course, and better patient care, but not everyone is in agreement with these higher standards because this also requires greater cost to the individual. It requires greater time, of course, and because of the greater cost, greater time, it may then limit the accessibility to certain individuals. You might not be able to afford to put aside the money or the time that you need then to become a pharmacist or to become a nurse practitioner. So what are some critical issues for the health workforce? This is a pretty good list. I'm not going to read through all of this. We have seen a demand for health care. Okay, the more patients that we cover by health care expansion or health insurance expansion, the more demand for providers. There is a shortage of primary care providers, and other education issues are listed below. So you see things like a need to integrate physical healthcare services with behavioral health and dental care, areas that are often shortchanged but are essential to health. Optimizing the use of IT, leveraging unions and labor management partnerships. So with the health professional shortages, and your podcasts reviewed this as well, we need to, of course, consider how we can address these shortages. There's population growth, there's more aging who have a greater number of healthcare problems, increased needs, more chronic illness as well because of the way that we're living. And the increased demand for healthcare providers might not increase the supply of healthcare providers, and we've already covered some of the reasons for that. We also see that in rural areas there are greater shortages, and the consideration that comes up quite a bit is whether there need to be changes to scope of practice. So scope of practice is what you are allowed to do as a certain profession according to your licensure or according to your registration or certification. Changes in healthcare financing and the organization of care are listed here. This will, of course, impact the health workforce as well. And the need to coordinate care, as we've talked about quite a bit in this course, comes into play as well. It was mentioned already a few seconds ago that there is a need to integrate physical health, behavioral health, and dental health. And that is because behavioral health and dental health impact physical health. It's all connected. Okay, this is all interwoven in regards to our health. So it's important to note that the ACA included mental health care as one of its 10 essential benefits. And there was an act back in 2008, the Mental Health Parity and Addiction Equity Act, that said that you had to provide as much coverage of mental health care as you did for physical health care. It's important to note that IT, of course, has an impact on the health workforce. We need to make sure that health workers are comfortable using IT or able to use it effectively. There is greater telephone communication because of fewer primary care visits, fewer hospitalizations, so that's important as well. And telemedicine, as we've seen during the pandemic, has become something that more and more providers are relying upon. So all of this impacts the health workforce. And along with everything, we look at regulation and the need for regulatory reform. The increased role of non-physician providers comes into play. Should nurse practitioners be able to practice without supervision? Are some scope of practice limitations getting in the way of adequate patient care, good patient care, adequate access? And it is important to note that healthcare unions and labor management partnerships are extremely important. When you work in management, you need to understand labor and understand labor's demands. Benefits like fixed nurse-to-patient ratios are important for the health of your nurse to prevent burnout, but the health of your patients as well. Shifts, number of shifts, improved health and retirement benefits, the possibility of strikes as well. And that is the end of our Chapter 9. Thank you.